Hi, my name is Savannah Perez, and I'd like to talk to you today about health disparities. Health disparities are the differences among all of us in our health based upon socioeconomic status, gender, race, ethnicity, and the list goes on. I chose the research topic cholera because I felt as though it really represented health disparities. Cholera is found in poor and developing nations with people who have a low socioeconomic status. They don't have access to good nutrition, they have maybe a bad environment, and they don't have enough resources. However, in America, we don't deal with cholera because we have a good infrastructure of our sewage system, and we have resources to treat diseases like this, and the list goes on. But this is just a very general way to explain how health disparities works. It's just that difference among people in health in our environment. So I'd like to talk to you about residential segregation and access to medical care. This is linked to poor health due to increased stress, increased exposure to environmental toxins, decreased access to medical care. Gaskin and colleagues in 2012 did a study and they examined the association between residential segregation and access to primary care physicians. They found that African American and Hispanics were substantially more likely than white people and Asian people to live in areas with a shortage of primary care physicians. Racial and ethnic disparities in treating heart disease. Gornick and colleagues did a study in 1996, and they looked at the medical care service history of people 65 and older covered with Medicare. And they looked at participants' median household income and their zip code. And then they compared the utilization rates between black people and white people. The graph showed that black people and white people were being released from the hospital at the same rate when they had low income. But when the income was high, white people were being released from the hospital faster than black people. So these results showed that black people tend to be sicker than white people. Now looking at disparities in kidney failure. When kidney fails, you have two ways to treat it, dialysis or a kidney replacement. So Alexander and Sengal in 1998 did a study to try and see the steps of getting a kidney transplant and to see how black and white people differed in achieving these steps. So step one is medical evaluation, make sure the patient is interested and suitable for a kidney. They found that black and white people both are likely to be equally interested. Step two, make sure the interest for a kidney is definite. Black people are less likely for a transplant interest than white people. That's what they found. The third step is to complete the pre-workup test. They found that black people are less likely to complete the pre-workup test than white people. The fourth step, to get their name placed on the regional waiting list for the kidney, and they found that black people are less likely to have their names placed on the list. The results kind of showed that the disparity could be because of a number of factors due to lack of trust in doctors and hesitance to undergo the procedure. Now let's talk about mental illness disparities. Dr. Satcher released a report titled Mental Health, Cultural Race, and Ethnicity. Found that black people are diagnosed accurately less than white people when they are suffering from depression or seen for psychiatric evaluation. For example, schizophrenia is a great way to show this. For many years, clinicians saw patterns where black people had higher risk of schizophrenia than just diagnosed affective disorders. So an explanation for these findings was clinician bias. Clinicians are predisposed to judge black people as schizophrenic, but not as suffering from an affective disorder. So throughout all of this, we learned many things, many disparities have occurred, and the government's trying to work on this. Step one, they're assessing the extent of racial and ethnic differences in healthcare, not attributing to access to care, for example, if someone can pay insurance or not. Two, they're evaluating biases, discrimination, stereotyping of the individual, provider, and patient, institutional, and healthcare system levels. And three, they're providing recommendations to eliminate health disparities. So there's a whole combination of reasons why health disparities exist. Residential segregation, access to health care, socioeconomic status, race, ethnicity, doctors stereotyping patients, what we are exposed to in our environment, and a patient's lack of trust for a medical procedure. There have been really awesome prevention methods to help prevent health disparities. The first one I found was Traditional Food Project. In 2010 and 2012, American Indian and Alaska Native adults were twice as likely to be diagnosed with diabetes than white people. So this program taught ecological knowledge and health promotion. And the next thing I found was Living Well with Disability. This helps people with disabilities learn skills to manage their health by teaching goal setting and problem solving skills that help remove barriers to maintaining a healthy lifestyle. Lastly, I'd like to talk about some things that I came up with. I would create a nutritional program. So every city in the US should have an Aldi supermarket. Aldi is super cheap and they're going all organic in January 2017. So if everyone has resources to nutritional food, maybe obesity levels would go down and health would be increased. Another program I wanted to create was for gym class. Everyone from elementary, middle school, and high school has to attend 5 days a week of gym class for an hour. And I feel as though that would really boost health. So thank you for listening.